Hi, everyone. I think everyone should be logging in. It's right now 6 o'clock, so I think we're going to go ahead and get started with this part of our seminar series. So for those of you that have not logged into the other parts of the seminar, maybe joining us for the first time, sorry, technical difficulties over there. These are seminars that we normally in pre-COVID times used to actually do in person, and we would do a few hours and kind of go through all of the topics at once. But clearly this year is a little bit different, so we are changing things around a little bit and have decided to do a series of lectures. And so if you've tuned in before, you may have kind of heard the IVF discussion or the IUI discussion or the simple evaluation discussion. So today we're really focusing on donor eggs. So we're not going to cover all of those other basic things that have been covered. If you do want more information on the other topics, we do have those available on our Facebook site, the seminars from previous weeks if you want to tune in for those specific topics. So we'll go ahead and get started with donor egg part of the discussion today. So we're going to start off by just kind of reintroducing myself here. Let's see if our little equipment works here. So I know that we all introduced ourselves kind of at the beginning, but just to kind of review, I am one of the 4 physicians here at Coastal Fertility. I was actually born and raised in California. I've been in the South Carolina area for about 6 to 7 years. I did all of my undergrad training at UCLA, and then I completed medical school again in California at the California USC. Did residency in OBGYN at UCLA, and then also stayed there for my reproductive endocrinology fellowship. As I mentioned already, I've been here since about 2014, and as similar to the other partners in the group, we are also the REI group at MUSC at the university, and have the pleasure of kind of working with the OBGYN residents and seeing patients over at MUSC as well. A little personal information before getting going on to the topic today. I'm married. I've been married to my husband for 14 years. We met at UCLA in undergraduate. He is not in medicine. He is an engineer. We have 3 children pictured here. I have a 7-year-old girl and 2 boys, 7 and 4. We have a little dog who's 14, and we have a new puppy that we're getting at the end of December. So that's kind of our family. That's our picture from this Halloween when we were Star Wars. All right, so now jumping into our actual discussion today, what is donor egg IVF? So everybody may not have heard of donor IVF in the past and may not know exactly what that entails, but basically it's the process of where we retrieve eggs from the ovaries of a woman with normal function, normal healthy ovaries, and we donate those eggs to a couple that is having infertility issues, usually from an egg quality or an egg issue. And so it is the process of donating eggs from some young healthy woman to an infertile couple who can use those eggs for their treatment. So who would be a donor for who would be a candidate for egg donation? There are a lot of reasons that we do egg donation, and we'll kind of go through the different options. Probably the most common reason is for women that ovaries are no longer working. A lot of that is due to age, where we know that the pregnancy rates with our own eggs get a lot worse as we get into our kind of mid to late 40s, and our eggs are just not healthy enough generally to cause pregnancies on our own. So that's probably one of the more common reasons that we do egg donation. We do have women that have ovarian failure or ovarian issues for other reasons, for genetic issues they were born with, where they never had functioning ovaries or viable eggs there. Some women have gone through treatment, usually for cancer or other things, or they've had chemotherapy or radiation, and their ovaries and eggs have kind of been harmed so that they can't use their own eggs for fertility treatment anymore. So those would all be very common causes that we would look at doing an egg donation cycle. Some women have had ovaries that have been surgically removed. That may be from cysts or cancers or other things in the past. So they physically just don't have any ovaries because they've been surgically removed, and that's where the eggs are going to be coming from. And so we can offer egg donation to women who don't even have ovaries anymore. Some women we see have totally normal ovaries. They have very healthy eggs in those ovaries, but they may be carriers of specific genetic conditions that are in their family that they don't want to pass on to their children. And so sometimes women in that scenario will elect to use donor eggs, not because they don't have eggs of their own, but because they don't want to pass on that specific genetic disease to their children. And then finally, this is kind of what we had talked about originally, women who have gone through treatment, whether that's with IUI or IVF, and we have not had good success, usually if we think it's due to an egg quality issue or an egg number issue, the next step usually in the progression would be to talk about using a donor egg.
Good question.
Yeah.
Amy wants to know where the donor eggs come from.
So that's a great question. And we're going to talk a lot about that in the future, in the next couple slides here. We're going to spend a lot of time on that part of it, actually, because that's probably one of the most important things to kind of know. So the reason that egg donor treatments work so well for us is kind of this same idea that probably has been discussed in prior talks as far as the ovarian reserve and aging as we get older. This is kind of a common graph that we see really looking at fertility rates at different age points. And I'm not sure how well this is coming across the screen, but down here we have women's age. So this is us kind of getting older into the 40 to kind of 50 age here. And these are pregnancy rates with our own eggs. And you can really see it stays pretty consistent up until about that age of 35, which we all kind of know of, you know, it's kind of that fertility important age. And then we kind of see this decline here. So when we get into kind of our mid to late 40s, we really have very low success with our own eggs. So the whole idea between egg donation is that we can get eggs from a woman in this range here with these nice high pregnancy rates. Even if we're technically this age, we're going to be getting the pregnancy rates from over here. So that's the idea behind egg donation. Let's see if we can get to our next slide. So this is the question that was just asked. So where do I get the donors? Very good question, very important question. And there are a lot of ways to get donors, and we're going to go through that in a lot of detail here. That's going to be the majority of the discussion today. No donors are an option, and that's somebody who you know, usually a relative or a close friend who has agreed to donate. That, interestingly, is our least common way of doing egg donation, and that's probably about 3 to 5% of our cycles. So by far the least common option, and that's probably because a lot of people just don't have siblings or friends that want to donate eggs to them in that scenario. But most of our egg donation cycles are anonymous, and we'll kind of go through these today. One is a process called a fresh egg donation cycle, and we'll talk about that in detail, but those are women who we kind of recruit from this area. And then we also work very closely with one of the donor egg banks, which essentially are commercial businesses and banks that are kind of associated with different fertility clinics around the country that offer services as far as egg donation. So we're going to first go over the fresh donors, and this is again in the anonymous category, but kind of the first option that I mentioned. It'll make sense when we go through this why they're kind of termed fresh donors. So these are women that we recruit and screen as Coastal Fertility. They are women that are usually local in kind of the South Carolina, North Carolina, Georgia area. As I mentioned, we recruit them, we screen them, and when I say screen them, there are very specific requirements and recommendations by the FDA of how egg donors should be screened. So that is a very standardized process across the country. They fill out a lot of information before we even see them, a very long questionnaire kind of about their health history, about themselves. If they kind of make it through that point, we bring them into the office and they get a pretty thorough screening, which we're going to go over in more detail as far as health evaluation, egg quality evaluation. They see a psychiatrist, they get drug tested, genetic tested, so it's very thorough. And I think last time we looked at this, our statistics as far as how many donors apply, you know, how that relates to how many are actually selected. Out of every 100 that apply, we usually pick about 2. So it's a very selective process. The reason that it's called fresh is these donors, when you are viewing them, they have not yet gone through the IVF process and they have not yet had their eggs taken out. So once selected by a recipient couple, that person would then go through an IVF stimulation. We would do an egg retrieval, take out their eggs, and then those eggs would be fertilized with the partner sperm or donor sperm in a fresh manner before they are ever frozen. Those are grown out in our laboratory, and then those resulting embryos would be transferred into the recipient's uterus. So that's why it's kind of termed a fresh cycle. There are a lot of pros to these cycles. These tend to be our most popular cycles. They tend to have a much higher pregnancy rate, and we'll go over that in a little bit more detail later in the talk, but as high as 70 to 75%. Because we are not giving you just a portion of the eggs, they usually tend to have more eggs that you receive and therefore more embryos frozen kind of for next attempts or later on in the future. I can get this to work there. One too many. Okay. So then that is kind of contrasted with the donor egg bank model. And again, we work very closely with the donor egg banks as well as with our fresh donors. So we really don't have a preference. We like to give our patients options because there are definitely pros and cons, and every option is different for every couple. And so the option with the donor egg bank, this is a little bit different model in that these are women that are across the entire country. They are recruited and screened either by us or by other fertility centers across the country. The main difference here is these women have already undergone their IVF cycle and they already have had their eggs taken out and their eggs are already frozen, which is why it's called a frozen egg bank. And these may be frozen at our center. We are a certified egg freezing center for Donor Egg Bank USA, so they may be here. They may be at a center in California, Seattle, anywhere across the country that's an affiliated center with Donor Egg Bank. And so what happens in this kind of a process is when you select a donor from Egg Bank, we are shipped what's called a lot or a group of frozen eggs that have already been frozen to us. We would then thaw those, fertilize with the partner or donor sperm, and then grow those embryos out for transfer into the uterus. So it's just a little bit different model. The pros to the donor egg bank, there's a much wider selection of donors because you can imagine these are hundreds and hundreds of women throughout the whole country. So if we're looking for a specific ethnic background, oftentimes we will look to donor egg bank to have more selection in that area. It's a quicker overall treatment cycle because we're not having to put the donor through a stimulation to get the eggs. The eggs are already there. We just ship them and we can use them in that manner. It does have a very good but a little bit lower pregnancy rate of about 55% per cycle. So this is kind of what I alluded to earlier. Who are the egg donors? These are usually young women in their 20s and 30s that, again, we recruit and we screen. I mentioned this before, but we screen them extremely thoroughly. They get a full history and physical exam with our physicians in the office. They get drug screening, which they do not know about before coming in. They get a full panel testing for any genetic diseases that they may carry so that we know that before selecting them. They get infectious disease screening. So those are things like hepatitis, HIV, things that we think would be important to know. And then they also do have a psychiatric evaluation before being accepted into the program to make sure that they understand what they're doing, understand the ramifications later on, and understand this is an anonymous process. So once you go through kind of deciding, is this a right option for me and which option would be the better option, how do you as a patient go about selecting your donor? And so that's a pretty streamlined process here. We have a very large egg donation program at Coastal with a full team of nurses and administrators that kind of help us with that. And so what they would do is they would give you log-on information to both the Donor Egg Bank site and our Fresh site, and you would get to log in and essentially look through these donors, and you get to see a lot of information on them. You get to see childhood photos, adult photos in some situations. You get to know their health history, their family history, their genetic history. So you would have full selection of that. It is not a situation where you just come in and say, I want to do an egg donation cycle, and we say, okay, great. Here's the next donor on the list. You get this donor, take it or leave it. That's not how it works. You get to look through all these profiles and find a donor that you feel comfortable with that's a good fit for your family. So then once you select your donor, the question would then become, what does this involve for you as the patient as far as testing, evaluation? What does this treatment look like? Is this going to be as intense as an IVF cycle would be? So we do have some pretty standard evaluation. This is really not much different than what you would be doing in an IVF cycle to make sure that your body and your uterus look good for carrying the pregnancy. We do have some uterine evaluation that usually is going to be with something called an HSG, which I think Dr. Selly talked about, or maybe a special ultrasound called a saline ultrasound to make sure that that uterus looks good for carrying the pregnancy and for implantation. We recommend our standard preconception or pre-pregnancy screen as we do for all of our patients. So that means making sure your thyroid is under control, making sure that we don't need any booster vaccines before getting pregnant. We are required to have, as we do for the donors, we also are required to have the recipient couples undergo that infectious disease testing as we just mentioned. So again, that's things like hepatitis B and C, HIV. And then we also do require a psych visit for the recipient couple, which sounds a little strange, but it actually is a very great beneficial visit. And this is a time where you sit down with a professional and kind of go over, what does this cycle mean for us, and do we need to disclose this to our friends and family, that this was not our egg, and really importantly, how do we disclose this to our child later on, and how do we do that at age appropriate intervals? So it's a very, very useful visit that our patients really love. So that's kind of our standard screening for everybody. There are other screening recommendations that would kind of be patient by patient basis, depending on your age, your health history, medical history, medications. And so those things can include, some basic health clearances like additional blood testing, heart clearance with things like an EKG to make sure that the heart looks healthy enough. And that would usually be in our patients that are over 44 years of age. We usually want to make sure that the pap smear, the mammograms are up to date. And again, that would be in our patients that are over 40 for the mammogram. And then a lot of times we will also have you meet with a maternal fetal medicine doctor. And those are the doctors that deal with high-risk pregnancies, and really to discuss, if we're looking at over 44, into our late 40s, 50s, what are the implications of pregnancy on your overall health? What are we at increased risk for during pregnancy? And kind of the same thing for patients that have any underlying medical issues. We want them to meet with the high-risk doctors to kind of talk about the risks of those medical conditions in pregnancy. So it would be a little bit of an additional testing kind of based on age and medical history. Testing for the male partner. If we are using a male partner's sperm, we would obviously require a semen analysis, which is a basic sperm test. We clearly want to make sure we have sperm to work with before jumping into the whole donor egg process. And if we don't, then we want to take some time to do some additional evaluation for the male partner. If we're using donor sperm, then we just need to get the donor sperm here and make sure that it looks reasonable before we jump into the process. Male partners are also obligated to do that same infectious disease blood work that we already mentioned. And then I put also on here for the male partner possible genetic carrier screening. And that would be if we had a donor that carried a specific genetic disorder, where we would know that the child would only be affected if the male partner also carried that disorder. So those donors would not be eliminated. We would just need to check the male partner to make sure that both the donor and the male partner are not carriers for a specific disease, to make sure that we didn't have a risk of having an affected child. Technical difficulties. Holly, you want to just hit the arrow over? Yeah, we might be out of batteries there. Okay. So how does the treatment work overall? So again, it's very similar to an IVF process, as Dr. Schnorr talked about last week. So for anybody who was on, that would kind of be a similar process. So this again is more focused on the fresh egg donation cycles, because remember, again, these women have not yet gone through their IVF stimulation. They have been screened, they are ready to go. We just have not gotten their eggs out yet. And so they would be on about 2 weeks of fertility medications to stimulate the ovaries, and that's kind of pictured here, to grow a lot of eggs for us. And these donors are selected because they have a lot of eggs, and so we usually expect a lot of eggs to grow. They would then undergo the process called the egg retrieval, which is done in the office here at Coastal Fertility, where we are able to actually retrieve the eggs from the ovaries with a needle. At that point, those eggs are now your eggs as the recipient couple, and we would fertilize them in the lab that same day with either the partner sperm or donor sperm. That's kind of pictured here. Once we do that, the embryos are then grown out in the laboratory for a series of days, and that's kind of pictured here. We like to grow them out as long as we can, because that really helps us select the best embryos in the bunch. And so we generally, in our donor cycles, because we have such healthy eggs and a lot of eggs, are almost always able to grow them out to this day 5 stage, which is called a blastocyst embryo. And those would be considered very good quality, healthy embryos. Concurrently, during that time when the donor is undergoing her IVF stimulation, you as the recipient patient would also be undergoing treatment to get your uterus ready for the implantation. And that is a much simpler process in the IVF cycle. And so what we usually would have you on is just some oral estrogen pills to get your lining ready. And then once we know when that retrieval is going to happen, we need to time that up with the donor cycle. And so you would start some progesterone at a specific time to kind of get your lining in sync with the donors and get that lining of the uterus ready for implantation. And then what happens at that point when the embryo gets to day 5 of growth is we are going to take usually one embryo in a donor egg cycle, almost always one with rare exceptions, and we would transfer that into the uterus. And that is pictured here. That is a very simple procedure. There's no anesthesia. You and your partner both get to be in the room. It does not hurt. It kind of feels a little bit like a pap smear, and we just drop the embryo straight into the middle of the uterus there. Oh, getting a little bit too excited there. Okay. So that would be a fresh model. Now it's a little bit different when working with the donor egg bank, as I mentioned, because we're not having to do any of that initial stimulation part and retrieval part. And so what happens in that situation is the eggs are just sent here, they're frozen. And so we can essentially immediately just prepare your uterus as the recipient patient in the same manner with the estrogen and progesterone. And we would time, instead of the retrieval, we would now time the thaw of the eggs when we start the progesterone. And then everything else in the previous slide is true for this situation where we would thaw the eggs, we would fertilize the eggs, grow them out in the same manner, and then transfer the embryo into the uterus. And in both of these models, if we have more than one good embryo on day 5, we're still usually going to just transfer one embryo into the uterus, but any other embryos there, we would freeze those. So those are frozen for later use or next attempts. Nothing is going to be wasted. We're either going to transfer it or freeze it for later.
Okay, Amanda's World wants to know, what if a recipient hasn't had a period in a few months and has 0 chance of pregnancy?
So the presence or absence of a period does not tell us that you can or cannot get pregnant. And so with the donor egg cycle, I mean, obviously we want to work you up to see why you're not getting periods and make sure that there's nothing wrong with the uterus itself. But even patients that are in menopause, that have gone through menopause early who get no periods and have no ovarian function, we don't need a period for this because we can prepare your uterus with the hormones that we give you just as well as we need to with a normal cycle. And so we really don't need you to be having periods for this kind of a treatment, honestly. Did that answer the question, Holly? Yeah.
Yes.
Okay.
And then she also wanted to know about embryo donation. Do we do
okay.
embryo?
Yeah, we can talk about that. Let me see it.
Okay.
Let me keep going on this and then we'll go into
Then we
embryo
can
adoption.
talk
Remind
about
me
that.
to
Okay.
talk about that because I don't think
Okay.
it's on the slide. So, the most important question probably is how well does egg donation work? And bottom line, egg donation really is going to give us our highest pregnancy rates of any fertility treatment that we can offer. And again, this is because we are hand selecting women with healthy eggs, fertile women, young women. And so obviously that's going to optimize our pregnancy rates. And so this is a really interesting slide here. Again, this is kind of like the national data that's published every year. This is not coastal fertility data, but just to kind of get a sense of what that means. This is kind of that initial line we saw where as we get older as women, when we're using our own eggs, which is this green line, we know our pregnancy rate decreases. The blue line here is with donor eggs. And so that really shows us that it is not the age of the woman and it's not the age of the uterus or the body that pregnancy is in. It's really all about the eggs because no matter how old we are when we're having an embryo implanted, if it's from a donor egg cycle, it's going to have this consistent pregnancy rate kind of throughout, meaning that our age now doesn't really make a difference as much because it's an egg quality issue that determines the pregnancy rates. So how well does it work at Coastal Fertility? So this slide is our own fresh donors from our own donors that we recruit and screen. And we have different ways to do those fresh cycles. One is called a single cycle, which is kind of what it sounds like, which would mean you as the recipient couple are the single recipient. So however many eggs that donor makes, it may be 15, it may be 20, it may be 40 in certain situations, you get all of those eggs. So you get a lot of eggs. Pregnancy rates with those cycles are as high as 80%. This is probably our most common option that's chosen, which is still a fresh cycle. It's still our donors, and we're still putting those people through the stimulation. but we would split the eggs between you and only one other recipient couple. So you would get about half the eggs, which usually is still more than 10 to 12 eggs. So it's still a good number of eggs. And we're getting a nice high pregnancy rate of about 75% with that kind of a cycle, but also minimizing the cost because now we're sharing the cost. So it's not going to be as expensive as having all of the eggs to yourself. Donor Egg Bank is a little bit different, and this I kind of took from their website. They publish kind of their own national data from their egg bank annually. One of the main differences with Egg Bank is you do not get all of the eggs from a donor's retrieval. So let's just say that there was a donor out in Seattle having a retrieval done and she got 30 eggs. They do not give you 30 eggs. And so what they do is they group those eggs into lots of eggs, usually between 5 to 7 eggs, and they freeze those 5 to 7 eggs. So when you purchase a lot of eggs from Donor Egg Bank, you are generally getting between 5 to 7 eggs. So it's a little bit less than what we would give even with a split cycle of our fresh. But usually still can give us a nice high pregnancy rate. And so generally their pregnancy rates, clinical pregnancy rate, you can see around 60%, all time is around 55%. So they've kind of bumped it up a little bit in the last couple of years. So very good pregnancy rate, in comparison to IVF, it's a very solid pregnancy rate. It's just not quite as high as with our fresh donors. This is our egg donation team. And so at Coastal, as I mentioned, we have a pretty large egg donation program. And so we have a full team of nurse and administrators that work with our egg donor patients. This is Sarah Boyd. She's our main, third-party coordinator. We stole her from New York from a big egg donation program up there. She's a Clemson grad, and so we managed to convince her to come back to South Carolina. So you will be working very closely with Sarah. She kind of helps us matching up all of our donors and getting our donors in and working with our recipients. Carrie Maness is one of our other coordinators. Carrie was actually our third-party nurse coordinator for a long time before we got Sarah down here. And so Carrie does a lot of remote work and kind of helps with the egg donation cycle still. And then Cheryl is our assistant who's been with us, I think, over 20 years. And so she's very experienced and would kind of help you walk through the cycle too. I think that may be our last slide. Let me just go here and see. Okay, so embryo adoption.
Yes.
That's fine. We can leave it on that.
Okay.
So embryo adoption is a little bit different. I didn't include it on the slide because it's a little bit different than egg donation. So embryo adoption is essentially taking embryos from couples that have already gone through fertility treatment in the past and may not have used all of their embryos, and so they have leftover embryos. Remaining embryos, and she had leftover embryos, remaining embryos in storage somewhere. We, as most fertility centers, do not have our own embryo adoption program, but we work very closely with some of these national organizations that are out there that kind of serve to hook up, recipient couples with people that want to donate their embryos. And so we definitely do embryo donation, but we would be working in conjunction with one of these other private companies. Embryo adoption is very different than egg donation because remember that with egg donation, we are recruiting and screening people because they are young and healthy and have healthy ovaries, and we know that pregnancy rate is going to be high. Very different from embryo adoption because in embryo adoption, these, remember, are infertile couples who have already gone through fertility treatment. They have used their kind of top embryos, and these are embryos that we have kind of remaining in the freezer. So they can be very successful cycles in a certain situation, but they can also have very low pregnancy rates in certain situations. And again, that really depends on the age of the woman when she was doing her fertility treatment, what her fertility issue was, what the quality of the embryos are, so if it was a leftover or remaining embryo from an egg donation cycle, we may be in that 60%, 70% range. But if it was from someone undergoing treatment who maybe was in their 40s, 42, 43, who we knew had diminished ovarian reserve and their pregnancy rate was low to begin with, that may be as low as, 10%. So it's a little bit of a different treatment option.
I have one more. There is a husband that's asking about insurance and how that works into using egg donation for egg donors.
So like all of our fertility treatments and insurance, it is very variable. And so there are some insurances that will cover egg donation, just like they would with IVF. There are some insurances that will not cover egg donation that may have covered IVF with a woman's own eggs. And there are some insurances that don't cover it at all, and they don't cover IVF or any other fertility treatment for that matter. So it really depends on your insurance, and that's something that we would be happy to go over with you when you come in for the visit. We would have you again meet with our financial coordinator coordinator, as you would with any, treatment option, to really go over what are your specific benefits, because it's really variable.
Okay, and then the last thing is
Mhm.
Amanda Rosario just wanted to let you know how much she appreciates you.
Oh.
She was so kind when she was there in August of 2018 for her initial appointment and had her salpingectomy. She's doing well from that surgery.
Oh, sweet. We love our little patients. That's wonderful. Thanks, Amanda. It's good to hear you're doing great.
So that's all the questions that
Great.
we have.
All right. So again, if you want any information on kind of the other topics that we previously talked about, whether that's IVF, IUI, basic testing, those should all be found on our Facebook page as well as the YouTube channel. And then I believe that next week, Dr. McLaughlin, I think that's our final one. Is that our final one?
Yes.
Is talking about egg freezing. So a little bit different, for more fertility preservation issues when you're not ready to actually inseminate and have embryos and get pregnant. So I will leave it at that. I think we're good to go.